Pandemics have a knack for throwing society into disarray, whether in the medieval ages with the Black Death or the modern world with COVID-19. Despite the centuries between them, both pandemics led to mass quarantines, travel bans, economic meltdowns, and shifts in societal behaviors. But how did they differ? And what lessons have we learned? Let's dive in. Disease origins and spread. The Black Death, caused by the bacterium Yersinia pestis, originated in Asia and spread to Europe through trade routes, primarily via fleas on rats. Its impact was catastrophic, with some regions losing up to 75% of their population. The disease's spread was aided by a lack of medical knowledge and the high density of people living in unsanitary conditions. COVID-19, caused by the SARS-CoV-2 virus, also spread rapidly, thanks in part to modern global travel. Within months of its emergence in late 2019, it had reached nearly every corner of the world. Unlike the Black Death, COVID-19 spread mainly through person-to-person transmission, requiring new containment strategies like social distancing and mask wearing. Despite the differences in their transmission methods, both pandemics underscore how interconnected our world is and how easily diseases can exploit human mobility. Quarantine and isolation measures. Quarantine measures date back to the days of the Black Death, when people were isolated for 30 days or more to prevent the spread of disease. Back then, the understanding of germs and disease transmission was rudimentary, yet these measures significantly reduced the plague's spread in some areas. In 2020, quarantine became a global norm, with entire countries going into lockdown to control the spread of COVID-19. Modern quarantine measures were guided by scientific knowledge, employing technology for contact tracing and implementing hygiene protocols. Unlike the medieval approach, today's quarantines were enforced through regulations, and social compliance varied greatly. The Black Death showed early forms of quarantine without scientific backing, while COVID-19 demonstrated the effectiveness of science-driven public health policies, though both encountered resistance from various segments of society. Economic impact. The economic impact of the Black Death was profound and long-lasting. With a significant portion of the workforce wiped out, Europe's economy underwent a drastic transformation. Labor shortages led to higher wages and better working conditions, effectively ending the feudal system in many parts of Europe. COVID-19's economic impact was equally severe, but in different ways. The pandemic caused unprecedented disruptions in global supply chains, forced businesses to close, and led to a surge in unemployment. Governments around the world responded with massive stimulus packages to mitigate the economic fallout, while the Black Death resulted in a shift of economic power to the working class. COVID-19's economic repercussions accelerated digital transformation and remote work trends. Both pandemics forced societies to adapt, but COVID-19 highlighted the fragility of the interconnected global economy. Societal changes. Societal changes in response to pandemics often involve fear, misinformation, and behavioral shifts. During the Black Death, fear and ignorance led to the persecution of minority groups, with many people attributing the disease to divine punishment or blaming specific communities. COVID-19 also saw an increase in misinformation and xenophobia, as well as panic buying and social unrest. However, unlike the medieval response, the digital age allowed for global communication and the rapid dissemination of scientific information. Social media played a dual role, both as a tool for spreading misinformation and as a platform for public health campaigns. On a positive note, COVID-19 also fostered a sense of global solidarity, with individuals, organizations, and nations coming together to support one another. While fear was a common reaction in both pandemics, modern society demonstrated an unprecedented capacity for collective action. Medical understanding and response. During the Black Death, medical knowledge was limited to rudimentary theories of disease. Treatments ranged from bloodletting to burning aromatic herbs, with little understanding of how the plague spread. In stark contrast, COVID-19 was met with a rapid scientific response. Within weeks of identifying the virus, scientists sequenced its genome, paving the way for the development of diagnostic tests and vaccines. Treatments evolved quickly as our understanding of the virus grew, leading to the use of antiviral medications and improved care protocols. The speed at which COVID-19 vaccines were developed and distributed was unprecedented, demonstrating the leaps in medical science since the 14th century. While the Black Death was shrouded in superstition and fear, COVID-19 showcased the power of modern medicine and international collaboration in managing a global health crisis. Long-term effects. The long-term effects of the Black Death were transformative, leading to significant social, economic, and cultural changes. The dramatic reduction in population altered the social structure, weakening the feudal system, and leading to greater mobility for the working class. Art and literature also reflected the societal trauma, with macabre themes becoming prevalent. COVID-19's long-term effects are still emerging, but they are expected to reshape global health systems, economies, and social interactions. The pandemic accelerated trends like digitalization, remote work, and telemedicine, changing how we live and work. It also exposed the weaknesses in public health infrastructure and the need for better preparedness for future pandemics. Both pandemics serve as turning points in history, prompting societies to rethink and rebuild in the face of adversity. Humorous take: toilet paper and rats. If there's one thing these pandemics have shown us, it's that every crisis has its peculiarities. The Black Death is famously associated with rats and fleas, the unwitting carriers of the deadly plague. Fast forward to 2020, and toilet paper became the unlikely symbol of the COVID-19 pandemic. Supermarket shelves were emptied in a frenzy, with people hoarding rolls as if they were gold bars. Imagine explaining this to a medieval European in a world where people are not fleeing from rats, but instead battling over bathroom essentials. It's a humorous reminder of how human behavior can manifest in bizarre ways during times of crisis, revealing both our fears and our coping mechanisms. Lessons learned. One of the key lessons from both pandemics is the critical importance of early response and preparedness. The Black Death swept through Europe largely unchecked, decimating populations and altering the course of history. In the case of COVID-19, early containment measures, social distancing, and global cooperation were crucial in managing the virus's spread. However, the varying degrees of success across different countries highlighted the challenges of implementing effective public health strategies. Both pandemics underscore the need for robust healthcare systems, transparent communication, and global solidarity in the face of emerging threats. As we navigate a world forever changed by COVID-19, we must apply the hard-earned lessons from history to better prepare for future pandemics. Moving forward, as we adapt to the new normal in a post-COVID-19 world, we find ourselves at a crossroads. The Black Death, with its far-reaching consequences, serves as a grim reminder of the devastation that pandemics can cause. Modern society, equipped with advanced science and technology, has the opportunity to chart a different course. Policymakers and public health officials must learn from the past, balancing public health concerns with economic and social stability. This means investing in healthcare infrastructure, promoting global collaboration, and fostering a culture of preparedness. While the Black Death led to significant social and economic restructuring, the COVID-19 pandemic offers a chance to build a more resilient and equitable world. It's not just about surviving the current pandemic, but about being ready for whatever comes next. That's all for today's video. If you found this video into the Black Death and COVID-19 as fascinating as we did, make sure to hit that like button and don't forget to subscribe for more engaging content. Thanks for watching and stay curious.